have divided my talk into these learning objectives, and over the next 30 to 40 minutes, I'm going to talk about the evolution and the rationale behind minimal access surgery. What are the core fundamental principles of this surgical approach, and the various safety aspects which we are all always watching out for, and what are the future possibilities of this way of doing surgery. So, what do we mean by minimally invasive surgery? It basically, in the simplest of the words, this refers to the surgery which is being done through small incisions using some specialized instruments. And it is known by many different names. It is also referred to as a keyhole surgery or a buttonhole surgery. Well, these are not recognized medical terminologies or names for this approach to surgery. These terms are usually used when we are trying to explain to the patient and tell him or her how we are going to operate using a very, very small incisions which would somehow resemble the buttonholes or keyholes, which the patient will see later on. These are not medical terms. Medical term would be a laparoscopic surgery. However, laparoscopic surgery basically refers to the procedures which we are going to do intra-abdominally. But as we all are aware, minimal access or minimally invasive surgery is not only limited to the abdominal procedures. We are doing axilloscopies, we are doing preperitonioscopies, retroscopies, we are doing axilloscopies. So, laparoscopic surgery is not a true and complete representative of what I'm trying to talk about. Another name for minimally invasive surgery is actually minimal access surgery. And to my mind, this is the best name for the kind of procedures which we are talking about. Our access to the space or the cavity which we are going to operate is limited. It is minimal. We are going to access that space through a very, very small incision. It could be abdominal, it could be extra abdominal, or any other part or organ of the body. So, to my mind, the best name, if we have to select one for these procedures, would be a minimal access surgery. Now, depending upon the, excuse me, my slide is not moving. Yeah, excuse me. So, depending upon which organ or which space we are trying to operate. Now, we could be operating inside the abdomen, we could be operating inside the thoracic cavity, we could be inside some organs like the bladder or the uterus, we could be operating within a joint, or we could be simply doing a retroperitoneoscopy. So, as we can see here, the surgery, the procedure takes the name of the organ or the cavity in which we are going to operate. And thus it becomes a laparoscopy or thoracoscopy or a hysteroscopy or a cystoscopy and so on and so forth. This name, laparoscope, was actually coined by Professor Hopkins. He is the same gentleman who invented these rod lens systems in 1953. And without having these rod lens systems, a laparoscope would not exist and would probably be not be doing laparoscopic procedures. So a huge credit for the current kind of procedures which you're doing goes to Professor Harold Hopkins. Now, a little bit about the historical trivia and how the minimal access surgery originated and how the progress has been over the last century or so. So, although the actual laparoscope was available to us in 1953 only, but much, much, much before that, many people attempted to develop certain gadgets which would allow us to look inside the abdominal cavity. So, Von Otto, way back in 1901, he actually put together the speculums which are available, and he used to introduce that speculum inside the abdominal cavity and try to have a look inside the cavity using a candle light. This apparatus was known as a Lich lighter, and this is recognized and documented in the history as the first documented case, and they called it a cilioscopy, which is coelomic cavity is another name for the abdominal or the laparoscopic cavity. After that, in the era of modern laparoscopic or minimal access surgery, the first documented laparoscopic appendicectomy was done in 1983 by Kurt Sem. So interestingly, Kurt Sem was a gynecologist by training, and the credit of doing a first minimal access general surgical procedure, the lap appendectomy, goes to a gynecologist. A couple of years after that, in 1985, Eric Muhe did the world's first lap cholecystectomy. So 1990s and 1980s is considered as a golden period of laparoscopy or minimal access surgery. People were trying out new things, they were discovering different surgeries, and they were coming up with newer and newer procedures which could be done laparoscopy rather than open surgery. So Gare did the first laparoscopic hernia repair in 1987, followed by Reach, who did the first laparoscopic hysterectomy in 1988. Over the years, the specialty has diversified. Now, minimal access surgery is not only limited to laparoscopic surgery. With the introduction of the robotic systems, we are routinely doing robotic minimal access surgery. The credit for this first robotic lap surgery goes to Dan Stanovici in 1993. Geese did the first colorectal laparoscopic surgery, and then the first notes procedure, again a method of doing minimal access surgery. So the first notes were done in Strasbourg in year 2001. Laparoscopic surgery or minimal access surgery has now evolved into many different forms, which I'm going to talk about a bit later in my presentation. Uh, the current status is this: there is a universal adoption of this way of doing surgery. No surgical specialty has been left untouched as far as this technique or method of doing surgeries is concerned. It could either be general surgery, it could be urology, it could be orthopedic procedures, thoracoscopic procedures, endocrine surgeries, neurosurgeries. You name a surgical specialty, and you will find that the surgeons now are doing the procedures via minimal access approach. So, why all of a sudden minimal access surgery or this approach became so universally accepted? Well, the reasons are obvious. We are going to operate through very small incisions, and this leads to a drastically reduced post-operative discomfort of pain. Compared to an open surgical procedure, the requirement of post-operative analgesia is one-tenth probably. There is less chances of wound complications. So the patient recovers fast and stays in a hospital for a much shorter time. And obviously, smaller incisions are going to give you better cosmetic outcomes also. These are the benefits which minimal access surgery offers to the patients directly. Indirectly, it also affects our healthcare systems. Because of the shorter stay of the patients in the hospitals, there is a rapid turnover of the hospital beds. So the same infrastructure can now cater to a higher number of patients. The patients themselves return earlier to work. They are recovering faster and then they get back to their normal day to day life much earlier. And this contributes loss of man hours to their jobs, which are earlier being lost because of prolonged hospital stays. In the long run, all this is cost effective. With the advent of minimal access surgeries, we are not only treating our patients in a better modality, we are actually saving millions and billions of dollars for that.